Hi, we are the Asheville City Schools, a student support services team, here to introduce ourselves and tell you our plans for returning to learn.
I am Kavada Wynn, your Executive Director of Student Services.
And I am April Dockery, your Executive Director of Student Support.
We understand that school social workers are the link between our homes, schools, and communities. They are also a vital resource in our Return to Learn plan. They will continue to strive to ensure that our students and their families have what they need to succeed academically and to be physically and emotionally healthy. We are eager to get back to doing our part in offering our students the opportunity to be their best selves. We will learn, discover, and thrive. The Asheville City School counselors are working diligently on their virtual offices. Our students will have the opportunity to communicate with their counselors to discuss schedules, receive social emotional guidance, and academic support. They will also be able to schedule individual meetings for other questions that may arise. We want to stay connected. Our counselors are also excited to see all students who will be returning to our buildings. We have classroom guidance lessons prepared and ready for all of our Cougar family who will be meeting us in the classrooms. We will focus on ways to stay connected, resilient, and ready to learn. Rest assured, we will remain safe by wearing masks, social distancing, and taking all precautionary measures. Our priority is to ensure that all students are socially and emotionally stable upon their return. Our mental health TAs will continue to identify resources, triage services, and manage our students' social, emotional, and mental health needs. We shall stay connected and offer guidance, especially during this time of uncertainty. Please, if you find that you need support, call the Asheville City Schools Crisis Hotline at 828-350-6133. We are here for you.
School nurses will continue to support families and students and staff both in person and virtually depending on the student needs as follows. They will continue to case manage for all of our students with chronic health conditions, coordinate with families and healthcare providers to implement individual health plans for students, and continue to train staff members on how to provide care for students on a daily basis in case of an emergency, and follow up with students who have been excluded from school due to COVID-19. To facilitate students receiving appropriate medical evaluation and testing if needed, and determine when they can return to school. We'll continue to support our school safety teams and provide health education to our students. In addition, specifically related to COVID-19, school nurses will serve as a liaison and follow up with students who have been excluded from school due to COVID-19. To facilitate students receiving appropriate medical evaluation and testing if needed, and determine when they can return to school. For school safety, we will continue to do daily student and self-health screenings. Health monitors have been created for assistance in health screenings and social distancing. New cleaning protocols have been developed. Protocols for what to do if a student or staff member becomes sick on campus or comes to school sick. Sufficient masks, hand soap, towels, and hand sanitizer will be provided. A return to work protocol has been created to reduce potential exposures. We will continue to implement our safety protocols. This includes, but is not limited to, all emergency drills, tornado, fire, and crisis management.